we go. We have Leah with us today, and she has been a BayCare Plus licensed healthcare advisor for about the last 6 years with BayCare, and she is here to help us learn all about the basics of Medicare, whether you are at retirement age or it's something that's like me in the real distant future. um, but it's giving you some ideas of what coverage options are available to you, what you need to be doing, why you're still working, and then as you're starting to approach that retirement age. So, Leah, I am going to turn it over to you.
Wonderful. Thank you, everyone, for joining me today. To start off on Medicare, Medicare is a federal program that our government instituted in 1965. Medicare itself really hasn't changed a lot since then. And so with Medicare, that is offered through our government, there are holes and gaps in it. And so there are different options available on how you can financially protect yourself with coverage that's available. So to begin, we're going to start with the basics of what Medicare is, because Medicare can be very polarizing for people as they approach it, because unfortunately, it is something that everyone wants to talk to you about, and you can get bombarded through, first and foremost, your mailbox, the different commercials that you see on television, radio ads, and it can be very overwhelming. So to begin, as I said, Medicare is one of the most successful federal programs ever instituted by our government. Medicare is something that we pay for while we work. From the moment we start working, Medicare payroll taxes are deducted checks. So we're constantly paying into that. So there's a theory of thought that when you're actually eligible, you want to reap as much of those Medicare benefits as possible. And so there are different categories, or the ABCDs of Medicare. So to begin, what the federal government created what is called traditional Medicare. It is comprised of two pieces, Part A and Part B. So Part A piece of Medicare is our hospitalization piece. This is what covers the hospitalization piece of our healthcare when we are eligible for Medicare. Part B of Medicare is our medical or our outpatient piece. Medicare itself is a federal government agency. It's ran by CMS, the Centers for Medicare and Medicaid Services. However, to get your Medicare, you actually apply for your traditional Medicare through the Social Security Administration. They issue your Medicare cards and A and B effective dates like they would issue a Social Security card. Okay, so Part A and B of Medicare are what is offered by the federal government. There are certain levels of coverage. So with insurance, there are different terms we use: premiums, deductibles, and copays. Premiums are what you have to pay monthly to have that insurance. So when I talked about how we pay into Medicare throughout our working careers, our Medicare payroll taxes go towards the Part A piece of Medicare. And so as long as you or your spouse have paid in 10 years or 40 quarters into that system, when you go to take your Medicare Part A, there will be a $0 a month premium. Okay. Part B of Medicare is the piece that you have to pay for while you have it. So some people don't realize that there is a premium associated with Part B of Medicare. The Social Security Administration is who is going to collect your Part B. So they issue your Medicare Parts A and B, and then they also collect the premium. For anyone who decides to take your Social Security benefits, those monthly direct deposits, the Part B premium will be automatically deducted from your benefits amount. However, you do not have to take your Social Security benefits to take Medicare. To qualify for Medicare, you typically would have to turn 65. You would have to have be permanently disabled through the federal government. On the 25th month, you would be eligible for Medicare. If you have end-stage renal Lou Gehrig's disease, you could also qualify for Medicare prior to turning 65. So your Social Security and benefits and your Medicare are not tied together. You can activate them at separate times. Part D of Medicare is prescription drug coverage. So prescription drug coverage is not offered by our federal government. So the way to obtain Part D coverage is to either purchase what's called a standalone prescription drug plan, or you can join a Part C Medicare Advantage plan. Part C Medicare Advantage plans are when private companies have a contract with our federal government and they actually take over the administration of your Medicare benefits. Medicare itself is an expensive program for our government. When it was created in 1965, people weren't living as long. This is one of the largest generations to ever be eligible for Medicare. And so it's very costly to our government. Medicare itself is a payer system, meaning Medicare has a pay rate that they contract with providers. And if you are on traditional Medicare, you can go to any provider in the continental United States that accepts Medicare as a form of insurance. When you go, you present your Medicare card, and that provider is going to bill Medicare. Medicare is going to pay the claim. So, that being said, there's sometimes, human error with billing. There's fraud, waste, and abuse when it comes to medical costs. There's no checks and balances with the federal government. So Part C companies or Medicare Advantage plans came about in the early 2000s to where they take over the contract with Medicare to administer your benefits. And I'll get into a little bit more detail on what that is on the next couple of slides. So I talked about premiums. Premiums are what you have to pay to have the insurance. With Medicare, there are deductibles. That's what you have to pay when you're getting health care first, okay? So Part A has your hospitalization piece, has a deductible for the year 2024 of $1,632. And that's for a 60-day benefit period. So the first time that you're hospitalized and using your Part A of Medicare, you would be subject to that $1,632 deductible. Now, if you're hospitalized in January and you go back into the hospital in February, you won't have to pay that again. However, if you're hospitalized in January and you're hospitalized again in April, you will have to pay that deductible again because you're out of that 60-day benefit period. Part B of your medical insurance or your outpatient has a deductible annually for 2024 of $240. So that means the first time you go see your doctor every year, or you get blood work done, or any kind of health care that you're having outside of the hospital covered under Medicare, you would have to pay that $240 deductible under Part B. Once you pay that deductible, Medicare will kick in for your Part B services and cover 80% of your costs. You are left responsible for the 20%. So that's what I refer to when I talk about the holes and gaps of Medicare. Those deductibles that you have to pay, and then the 20% that Medicare doesn't cover. So there are different options when it comes to selecting how you want that coverage to financially protect you. So in this first scenario, you see original Medicare plus a Part D plan. That is indicating I am on traditional Medicare through our federal government. I do not have a network of providers. I do not need prior authorizations. I do not need referrals. I can go to that provider that accepts Medicare, and they are going to bill Medicare. I'm going to be subject to those deductibles and the 20%. I've also purchased a prescription drug plan because if I don't do that when I first become eligible for Medicare and I go to pick up that coverage at a later time, I will incur a lifetime penalty that is based on how long I went without that coverage. Some people don't want to be subject to those hefty deductibles of Part A and B, as well as the 20%. So there is the option to purchase additional coverage. It's called a Medicare supplement or a Medigap policy. They have different levels of standardized coverage against that. And they have plan names like Plan F, High Deductible Plan F, Plan G, High Deductible Plan G, Plan K, L, M, N. Those are standardized coverages that you pay for to protect against what Medicare doesn't cover. Medicare supplements you would purchase through an insurance company and you would have monthly premiums for that coverage. The alternative is to join that Part C Medicare Advantage plan. To now, a private company is going to take over the administration of your A and B benefits. When that private company does that, they are paid by the government to manage your health care. So Medicare Advantage plans do look to control costs. One of the ways that they can do that is through contracted networks of providers, meaning you lose the freedom to go to any provider that you would want to in the continental United States, and instead be limited to providers that that plan has gone out and contracted with. In addition, some plans do require referrals, and the insurance company might need to authorize procedures before you can go have them done. That all helps control the costs. Because these private companies are controlling the cost, they pass the savings back to the member. So in most Part C Medicare Advantage plans, prescription drug coverage is included in the plan at no additional premium. In addition, these Medicare Advantage plans will put extra benefits into these plans that aren't recognized by Medicare. A hot topic in regards to that is dental insurance. Dental is not a Medicare benefit. So if you are staying with traditional Medicare through the federal government, you wanted dental coverage, you would need to purchase a standalone dental plan. A lot of Medicare Advantage plans will have dental coverage built into the plan that members can use at no additional cost. Another example of extra benefits is routine vision to get your eyes checked through an optometrist, fitness membership so that you can stay healthy and active, because in healthcare, it's all about that preventative care and moving your body, as well as there are some extra benefits like an over-the-counter allowance, a food allowance, hearing aids, transportations, and those are all going to be based on the Part C company that you would join. So when you're comparing your out-of-pocket costs and which option makes the most sense for you, that original demonstration of staying on original Medicare with your prescription drug plan, you'll be paying 2 monthly premiums for that coverage. You'll be subject to those A and B deductibles, and then there's no limit to your health care in regards to what you're financially obligated with the 20%. With Medicare supplements, those standardized policies that go on top of the federal Medicare program, it's a pay now scenario where you're paying your monthly premiums. And in most cases, you'll be paying 3 monthly premiums because you always have to pay your Part B. You would pay your prescription drug plan premium, and then you would pay whatever supplemental coverage you select, and you're paying it now. It's very similar to a car insurance model, to where you pay your premiums and then you have little to no cost when you actually use your health care. But what's becoming more and more popular, especially in our part of the country here in Tampa Bay, because there are a lot of Medicare beneficiaries, which only makes these advantage plans more competitive to get your attention, is a Part C plan. So with Medicare Advantage plans, they often have premiums as low as $0 per month. Okay. You still have to pay your Part B premium. Social Security is going to collect that, but then it's going to be a pay as you go scenario. So it's going to be low, predictable copays that you will pay when you use your insurance. But built into these Medicare Advantage plans is called a maximum out of pocket, or a MOOP. What that is a predetermined financial amount, a stop loss, or your financial ceiling, to where if you are using a lot of healthcare within a given year, and your co-payments and co-insurance for Medicare A and B covered services were to ever reach that amount, your financial obligation to Medicare A and B co-payments and co-insurance would stop. Your healthcare would continue, but your financial obligation, because you'll have met the maximum out of pocket. That maximum out of pocket is really there to give you the peace of mind that if your health is being compromised, it's not going to wipe out all of your retirement and savings. You'll be able to get the care that you need. So, Part A, as I said, is the piece that we pay into while we work. If you paid in fewer than 30 quarters, the standard Part B premium in 2024 is $505 per month. If you paid between 30 and 39 quarters, the standard Part B premium is $278. But for most of us, we've paid in, so our Part A premium will be $0. The Part B premium is based on your income, and it's going to be based on your tax return from 2 years ago. So there's different income limits based on if you filed single, if you filed jointly, or if you're married and still file jointly. There's different thresholds. Most people are retired, or they will be retiring at some point with their Medicare. So income um, starts to lower. If you're lucky enough to be a high income earner, you will have a monthly adjusted amount that you will pay in addition to the standard Part B premium. So for 2024, $174.70 a month is what the Social Security Administration collects for your Part B. This premium does increase or adjust every year. I say increase, it did decrease 1 year, but most of the time the Part B premium does increase, and the Social Security Administration releases that in the fall. So, drug coverage. Drug coverage currently has a 4-phase system of coverage. Okay. Drug coverage will be adjusting for 2025. There are rumors going around, on what that will actually look like. We'll know a little bit more what that is going to look like closer to October. So, with the current system of drug coverage, our federal government does not offer it, but they still want to control how drug coverage is administered by the private companies that offer it. Okay. So what happens with the drug coverage is if a company is going to be offering that, they create a formulary where they list the medications that they cover on a tiered system. The government does review that to make sure there are certain qualifications when it comes to the Medicare. So the first phase of drug coverage that any Part D company must follow is the deductible phase of coverage. So there are some Part D plans where you may have to meet a deductible before your insurance kicks in. Once you hit that deductible, if your plan has it, you move to the second phase of coverage, which is the initial coverage plan. Initial coverage phase. Some Part D drug coverage does not has eliminated the first phase, so your plan for Part D may start you in the second phase of coverage, which is the initial coverage phase. During the initial coverage phase, the federal government gives every Medicare beneficiary an initial drug coverage amount of $5,030 for 2024. So if you think of that amount as a bucket of money, what that means is every time you get a prescription filled, the retail cost of that drug is going to deduct from that bucket. So if you're on a plan and that plan lists your medication as a tier 1, you might have a $0 copay for that medication, but that medication may retail for $10. So if you go to the Publix and you get that medication filled, you may pay $0, but $10 or the retail cost is deducting out of that $5,030 bucket. It's typically tier 3 drugs and higher to where we see that initial drug coverage amount deplete. Tier 3 drugs, if you think they are the medications that you see the commercials where everyone's singing and dancing, those are the brand names. Typically, tier 1 and tier 2 tend to be generic. Tier 3 and tier 4 tend to be brand names. Tier 5 tend to be specialty drugs, infusions, new drugs hitting the market that are still being looked at and in development, to give you a frame of reference. So it's typically tier 3 drugs and higher. So a tier 3 drug can easily retail for $1,000. So what an example of how that would affect you is if you go to the Publix and you pay, your $100 copay for your tier 3 drug, but it retails for $1,000, $1,000 would deduct out of that initial drug coverage amount. So what would happen is that by month 5, you will have depleted that amount and you move to the third phase of coverage called the coverage gap phase, or as it's most commonly referred to in Medicare, the donut hole. And there is nothing sweet about being in the donut hole because the cost of your medications goes up. You will now be responsible for a 25% coinsurance for generic drugs or a 25% coinsurance for brand name drugs, okay? The donut hole phase of coverage does not end until your true out-of-pocket reaches $8,000. So what that means is only what came out of your pocket during the initial coverage phase will count towards that, not the full $5,030. Your 25% coinsurance will count towards reaching the true out-of-pocket, as well as the manufacturer will pay a percentage to help reach that true out-of-pocket. If you meet that $8,000 true out-of-pocket, you will move to the fourth and final phase of coverage called the catastrophic coverage phase, where you will then pay $0 for the cost of your medications. This phase of coverage resets every January 1st, and there's no way to beat the system by changing Part D companies mid-year. Wherever you are in the phases of coverage follows you. Now, what's changing is that in 2025, the donut hole is being eliminated. And again, towards the fall, we'll know more on what that's going to look like in real life applications. So Medicare supplements, to refresh, are standardized insurance plans that you pay to cover what Medicare doesn't cover. The policies are standardized. The benefits for each lettered plan are the same no matter which insurance company sells it. The premiums will vary, and the premiums typically increase as you age. This helps pay for what Medicare doesn't cover. So, what are some of the pros and cons of Medicare supplements? The pros are you're only going to pay your premiums and you might have little to no coinsurance costs. It's going to give you the financial protection to cover the 20% that original Medicare doesn't cover. You don't need referrals and you can see any doctor that takes Medicare. The cons are it can get costly in premiums as you age. It only covers what Medicare covers, so there's no dental, there's no routine vision. You would need to purchase your own prescription drug coverage, and you pay monthly regardless if you're getting your health care. What are the benefits of a Medicare Advantage plan? Well, to have the contract with Medicare, the federal program, the private company has to cover everything that Medicare covers. So you can't lose any rights or protections that are offered in our federal program. Because private companies, are being paid by the government to administer your benefits, they pass those savings along to you. It can often be viewed as a simpler, more affordable way to get your medical coverage, as well as oftentimes prescription drug coverage is built in, and then you get some extras such as dental, vision, and more. This slide is just in reference to the peace of mind that with an Advantage plan, there is that maximum out-of-pocket protection. There's no balance billing or unexpected bills, and it means you'll never pay more in a given year than the specified amount of the MOOP of the plan you pick. So, deciding when to enroll with Medicare. Many people think that they have to stop working to take their Medicare, and that is false. Okay. You can continue to work at your current job and opt out of the employer benefit for health insurance, opt out of the employer benefit for dental, vision, or you can opt out of just the medical piece and you can keep your dental and vision policies with that. So if you or your spouse are still working and want to stay enrolled in your group, you absolutely can. You would delay your Medicare. You can delay the Part A piece of it. You could delay the Part B piece of it. There's different ways on which you can decide to when and where you want to take your Medicare insurance. So in scenario one, you or your spouse are Medicare eligible, you're still working, and you want to stay enrolled in your group coverage. Medicare oftentimes deems your employer coverage as comparable to what they have. So if you're still covered by your employer plan, you don't have to transition to Medicare Part B yet. You can still take your Medicare Part A if you'd like, because for most of us, that would be a $0 a month premium. And then you would delay your Part B piece, or you could delay A and B together until you're ready to retire. If your job has more than 20 employees and has a group insurance plan, you can continue your group insurance without incurring the late Part B. When it comes to retirement, you'll just have an extra step to where you'll have to submit 2 government forms to your local Social Security agency. One is an application for your enrollment. The other piece is your employer form, where your employer would fill out Section B of the form and submit that to the Social Security Administration to provide proof of credible coverage. And then they'll issue your Part B. Um, your employer may want you to wait until you retire to take your Medicare, but it is a personal thing. Typically, turning 65 or being eligible for Medicare for the first time is a qualifying life event to where you can disenroll from your group plan mid-year or whenever your birth month comes along. But we always recommend that you go directly to the benefits coordinator for your employer and verify that with them. So there are no missteps. When you're medical eligible and still working and covered by a group plan, you may want to take your Medicare coverage. So you can elect to keep your group plan and enroll in pieces A and B. Your group plan would pay first and Medicare would pay second. But we encourage you to give this careful thought because there's no true benefit to paying your employer premiums for your insurance as well as that Part B piece of the insurance. So many people that want to get started and issued a Medicare number will take simply Part A and then they will delay their Part B so they're not paying the additional Part B premium when they're also paying their employer premiums. Medicare scenario 3, you're Medicare eligible, still working, and want to drop your group plan. If you're in your initial eligibility for Medicare, it's a 7-month window around your birth month. Okay, so everything with Medicare starts on the first of the month. You have 3 months prior to your birth month to apply for the Social Security for your Medicare number and then pick which financial coverage you want. However, the government does give you your birth month and 3 months after for those procrastinators that are overwhelmed with Medicare and your options. Typically, people that do this think everything to start on the first of their month and their employer coverage to stop the month on the last day of the month prior to that starting so that there's no holes in coverage. If you're going to decide this and compare how you want, if you're going to stay in your group or you want to take Medicare, you're going to want to look at what your premiums cost, especially I know spouses, a lot of times if a spouse is eligible and you're younger and still working, having your spouse take Medicare will reduce your premiums. Deductibles you're going to want to look at on what your group employer deductibles are versus what they would look like on Medicare, either through your supplement or your Part C plan. And so a lot of times taking Medicare while you're still working can be financially beneficial. However, it's a personal choice. So I always recommend if you're contemplating this, speak to a healthcare advisor, speak to someone licensed, as they'll be able to go through the pros and cons of each to help you make that decision. When you go to retire and you're ready to get started on your Medicare, they do give you an 8-month window for that. To where your group coverage can end and you can pick up your Medicare within 8 months after. In my 6 years of doing this, I've always worked with people to have it start on the first of the month of their retirement so that they don't have a lapse in coverage. You'll have to fill out those 2 forms for Part B if you are older than 65 and out of your eligibility, your initial eligibility period. To do that. But if you don't pick up prescription drug coverage, Part D, within 63 days of your group coverage ending, you will start the clock on a Part D penalty. So because Parts B and D of Medicare have premiums, if you decide that you do not want to pay those premiums and you do not have another form of credible coverage, okay, you will start the clock with Medicare on lifetime penalties. So if you don't take your Part B when you're first eligible and you don't have another form of credible coverage, and you decide later on that you would like to pick up Part B coverage, you're only allowed to enroll with Part B between January 1st and March 31st. Your Part B coverage would not become effective until July 1st. The government is going to calculate how long from the time you turn 65 to when you're picking up Part B that you went without this coverage, and they are going to calculate a monthly penalty that you will pay for as long as you have Part B coverage. Same goes with prescription drug coverage. If you don't have credible coverage and you go without, they are going to calculate how long from your 65th birthday that you went without before you picked it up, and you will pay that monthly. These penalties don't go away. So to enroll in Medicare, most people will turn 65. It's that 7-month window. Uh, for people over 65, it's whenever you decide to come off that group. For over 65 and you didn't have credible insurance, you're only allowed to enroll between January 1st and March 31st. When it comes to Medicare, there are certain windows of when you can change. So the initial enrollment period you only get first. October is October 1st is when the world of Medicare explodes every year. And that's because that's when the benefits for the following year are released. Medicare Advantage or Part C companies cannot contact you without your permission. Okay, the government put that parameter there for the protection that your coverage would be leaving their hands. So Part C people cannot knock on your door. However, people selling supplements can knock on your door. But that's why come October, your television explodes, your mailboxes explode, you get so much Medicare mail and are so overwhelmed because everyone is trying to get your attention for you to reach out and start a conversation with someone that they've employed. Okay, so that runs between October 15th and December 7th. During that time, you could make as many enrollment decisions as you like. However, the one that you select last is the one that will begin on January 1st. If you're currently on Medicare and happy with your current coverage, you will get a letter in September called an annual notice of change where they explain any changes that are happening to your current policy. If you're happy with those changes, you can ignore the Medicare explosion every fall. However, for people on Part C Medicare Advantage plans, they do give you a second window the first 3 months of the year, January 1st through March 31st. People on original Medicare do not get this second window, only Part C people. So if you have a Medicare Advantage plan and you want to change between benefits, you can change during this 3-month window. You can change to a completely different company. You can go back to original Medicare and you can pick up a prescription drug plan. Um, that's all I have for you. Sorry I ran a little bit long. I'm happy to answer any questions. These are just some references. You apply for Medicare on ssa.gov, and then you can actually call Medicare 24 hours a day, 7 days a week, and the phone number is 1-800-Medicare. I am local here. I can put my business card in the chat again. There are no silly questions when it comes to Medicare. I truly believe in simplifying it for you all so that you can make the personal decisions that fit your lifestyle. So I'm happy to answer any questions moving forward when it comes to this stuff.
Excellent.
So,
Thank you so much. You did some great stuff. I did put your email address in the chat if anyone wants to reach out. If you have a personal question you want to be asking here, I did send one of those to you, Lee, so it'll be in your mailbox when you have a chance. Also, we will be sending out these slides post this event. I'll be sending it out later on today. You will be getting all of that. We do have a couple of questions. We had someone, and I think it's a key point to reiterate. I do remember you saying it, but if the person is older than 65 and they're working, they did get the Part A, but they are still employed with their health insurance, are they still liable for that Part D penalty when they go apply for it?
no, no, because so the way the penalties work is if you don't have what the government deems credible coverage or equal coverage to what is offered through Medicare, which is when you incur the penalty. So for anyone that stayed on their group plan with over 20 employees, your group coverage is credible coverage. You will have 2 extra steps though. Okay, you're going to have the extra step of filling out the 2 forms and submitting them to your local Social Security office. One you fill out, one your employer fills out. The employer form is proving to the government that you've had that credible coverage. The second step is whatever Part D company you select, whether it's a standalone prescription drug company or a Part C company with it built in, they are going to send you a letter saying, hey, CMS shows that you didn't have this coverage. Please submit your proof of coverage to us, which is confusing because these are two federal agencies and they don't share this information. So unfortunately, you have to do it twice.
Don't you love when they don't talk to each other? It's always fun. So the next, well, one is we have recorded this. It's still recording right now. The recording will be up in about 2 to 3 weeks, so you'll be able to watch all of this again. The next question is, I plan to stay for 7 more years when I turn 65 in December. When would I apply for these plans since I would carry my company's benefits?
Okay, so if you're turning 65 in December, you have the choice of either opting out of your employer plan and taking your Medicare, or you can delay your Medicare until you go to lose your coverage. So the only time that you can opt out of employer coverage outside of an enrollment period is during your initial enrollment period surrounding your 65th birthday. So you could say, hey, I'm turning 65 in December. I don't want to take Medicare yet. It's too much. I'm going to work another 7 years. That's no problem. Then you would either, when you go to retire 7 years later, apply for your Medicare, or you may get 3 years in to still working and decide, why am I on my employer coverage when the math on Medicare makes a little bit more sense to me? So you can still work and decline your employer benefits during the employer renewal period, which typically is in the fall in November.
So
So
could
it's a personal preference.
From what I've heard you said the whole time, would it be a really smart move if no matter what you're going to do, you at least kind of look at it when you're around your 65th birthday so you've got all your bases covered? And then at that point in time, if you don't want to do it all, you've still done the basics and you're not out any money, but you're making sure you're not going to be penalized or have any issues down the road.
Yeah, I mean, it doesn't hurt to take an hour and talk to a licensed professional and weigh your I know a lot of people are just so overwhelmed that they just push it off to the side, but sitting down and actually having a conversation and comparing doesn't, and getting your ducks in a row and getting an understanding of it doesn't hurt.
Excellent. All right. Our next question is, what if there's a coverage through the VA for prescriptions? Are you responsible to pay the penalty? So if they have VA coverage.
VA coverage is considered credible drug coverage. So VA coverage is always going to work independently of your Medicare coverage. So if you're going to the VA for doctor's appointments, if the VA can't see you and they're sending you out into the community for community care, the VA is still responsible for that. You can have your VA benefits and you can get your prescriptions filled through the VA. However, you can take your Medicare and do that in a second kind of operating system. So if you have VA benefits and you decide to join a Part C or Part D plan later, your VA will count as credible coverage and you will not have the penalty.
All right, we have one more question, and I did drop Lee's email again into the chat in case anyone has any questions they want to ask specifically to her. Oh, two questions. Isn't there an issue with future costs and fees if you go to supplemental insurance and later want or need Medicare?
Okay.
I think that you might have discussed that a little bit.
Can you repeat that question, or where is that question so I can see it?
Close to the bottom. Isn't there an issue with future costs or fees if you go to supplemental insurance and then later want or need Medicare?
Okay. So supplemental insurance or Medigap are standardized policies offered through private companies that stack on top of the traditional Medicare. So if us that that qualify for Medicare will never lose traditional Medicare offered by the government. That is a benefit that we have. Okay. So we can never lose that if you go to an Advantage plan. What happens with Medicare supplements is they of that federal program because these policies are issued by insurance companies. They have what's called guaranteed issue. So meaning that you can purchase them and that insurance company has to sell them to you. However, you only get guaranteed issue on those policies when you are in your initial enrollment period. Typically when you turn 65 or when you go to retire and take your Medicare for the first time. That time, that insurance company has to sell you that policy. After that is expired, you can still purchase Medicare supplements. However, that insurance company is going to have an underwriting department to where if you have a qualifying health condition, they can say, no, we are not going to sell you this policy. You're going to cost us too much. So that's where the persona that you will have trouble comes in because they don't have to sell you the policy. Typically, what happens is that as we age, our health conditions change, right? And so at 65, I might be nice and healthy, but at 70, I might have had a heart attack or developed diabetes, and I want to purchase a supplement. That insurance company can say, no, you're going to be too expensive to us.
All
Do
right.
that. So that's where that comes in. However, I do want to say that with Part C Advantage plans, the private company ones that administer, there are no pre-existing health conditions. So you can join a Part C Advantage plan as long as you have Medicare Parts A and B, you live inside their service area, and you're in an enrollment period to do so. Those Part C companies cannot tell you no based on health
Well,
conditions.
I am going to thank you. And if anyone has any additional questions, I am going to drop Lee's email address into the follow-up email so you can send her your specific questions that you might have, making sure you're getting the information that you need. I will have the presentation looped into this. This is filmed if you want to watch it again. The link for where the recording will be in about a couple of weeks will be on there. We appreciate you all being here today and look forward to seeing you next month. Lee, thank you so much. This was great information.